Come everybody, call this meeting to order Tuesday, May 8th, 2018. I'll call it at 6:04. This time I need approval of the agenda.
So moved, Mr. Chairman.
We approve. We have a second.
Second.
Any discussion? All in favor, aye?
Aye.
Opposed? Ayes have it. We've got new business tonight. I'm going to turn the floor over to Commissioner Kitchens. This was a request of his on the last meeting to have this special call meeting. So we'll turn it over to Commissioner Kitchens at this time.
Thank you, Chairman. There's been some discussion, as we all know, last couple of meetings. I think it was the first meeting of April that we discussed insurance, and I want to back up a little bit. I listened back to the tape, and it was on May the 2nd, I believe it was, of last year, when we voted to retain the broker that we currently used then and now. And the vote was for to retain the existing broker at a set amount agreed upon with quarterly reports so that we could show accountability and transparency, which was something we campaigned on. That was May of 2017. The 1st of April, and I remember saying at that time, we were behind the 8 ball then. I remember going to ACCG in Savannah, and we were at that time felt like we were behind the 8 ball on getting our insurance renewed and getting our stuff done. So we had the discussion of not wanting to get in the same place again this year. Roll forward to the first week of April. We started talking about it in March. Got it on the agenda, I believe, the first week of April, and discussed it, that we needed reports, and we didn't have them at that time, so we requested them. April 17th, we requested to have all the reports of commissions and payments at that time for the May 1st meeting. And the last meeting, we didn't have the reports, and our brokers were not here to address it. So I'd asked that we have them come in at this meeting to address why we didn't have reports, quarterly reports. I know at one time we were told we couldn't get them quarterly, and then we were told we could. So I'm just a little confused on what we can and can't get, but I thought the agreement last May was that we would have quarterly reports so that we could be accountable for the taxpayers' money, and that's what we intend to do. Do we want to open up to our brokers?
Yes. Partners, if you come forward and
we'll come up together. Facebook has Diamond and Silk. Today, y'all have the Beauty and the Beast. So, and without any, have to know which one the Beast is. But anyway, a couple of things I want to mention, and then Claudia can talk about it. According to information that I understand, is the reason they were not here last Monday night is because they didn't know there was a meeting last Monday night. Well, they have to be. You have to be told to have a meeting before you come to a meeting.
I don't want to interrupt you, but I will take a little bit of exception to that, because they were at the meeting on 4/17 when I was the one that said, I want these answers at the next meeting. So
I'll let her address then about her knowledge of the meeting and whether or not. So Claudia, go ahead. And she, while she's at it, she'll address the other issues that you talked about.
I did ask if there was a meeting, and was told that y'all were away at a conference, and that there was not going to be one because y'all were at a conference.
Please speak into the microphone.
Yeah,
oh, I'm sorry. Let me bring it down to my level. I was told that, so that was the reason I wasn't here. I was told that y'all were at an ACCG conference, and there wouldn't be one that week. Otherwise, I would have most definitely been here. I didn't get the, what do you call it, the distro email or anything. All I can do is apologize. It was my understanding there wasn't one, or I would have definitely been here.
Your name's on the email list as far as getting agendas, and
I didn't get it. I did this time, but I did not that time. I mean, I didn't.
You had another conversation also that was you were told. You called.
Yeah, and was told that y'all were at a conference. So
she had a personal conversation.
Well, the one, and
I did get it for this last one, but I didn't.
Not to belabor or for the sake of argument, I mean, we're talking about one meeting. I guess my biggest question is, since May the 2nd of 2017, when we agreed that we would retain you guys with reports, with accountability and transparency.
Let me pass out will you pass these out? I broke my ankle. I'm still nursing it. I have a list of all the reports that I've given, and I'll be glad to run through those with you real quick. While you're looking at that, let me address one thing on when you all asked, could we do it for a flat fee? And we said yes, that we would provide you reports. You all met, and I think it was Chris and Jake, not you, but the other Chris and Jason, and decided that y'all could not do that. And so we had to go back to the PEPM, per employee per member. And those income reports are provided on an annual basis. If we had stayed with the fees, then we could have produced that.
Well,
but
I mean, they send us an invoice each month.
yeah, because you would be sending us an invoice, and therefore you would be getting it. But because we chose to go, or it was requested that you go back to the original way of reporting would go with that, if that makes sense. Let me run through this list with you of some reports that were given.
Just to be clear, I mean, so you're telling me that there's no way we can get, other than an annual report of what we're paying?
Well, the 5,500.
The 5,500 that comes out.
Of which you don't see.
And I'll hand you one.
How often does it come out?
It comes out on an annual basis from the carriers. The carriers.
So I guess my question is, so from May 2nd of 2017, when we got an annual report, we can't get another one until May of.
That's correct.
Okay.
From the carriers.
From the carrier. I can give you one each month. In fact, I've got one through March the 31st that I'll hand out in just a minute to show you what we get. But
well, why weren't we getting them since?
Let me run through this, and now.
Well, just answer my question. Why weren't we getting one from May the 2nd till now?
I didn't send you one because I didn't know I didn't know I was supposed to send you that report each month. And the report is made up on an Excel spreadsheet. And what I do, I take my commission statement that's about that thick. It's got all the groups in there, and I'll pick yours out, and I put it on a spreadsheet and send it to you if that's what you want. And it will look like this. This is through, we have an effective date of July 1, so our first commission that we get is in August, because there's always a 30-day lag. And here's a report from August of 2017 to March the 31st of April the 30th of 2018, showing exactly what we made, a complete breakdown by total commissions, Claudia's part, Butch's part, partners benefits part. It also shows a PEPM of $31.10 PEPM, which is what was discussed. It also shows, we'll give it just a second. You see the first column says total commissions, and you see the total commissions that we received each month on the health plan for Blue Cross Blue Shield. You'll see even in December we had a debit of $1,895. I don't know why, but that happens with Blue Cross. Shaw Hankins tell you the same thing. Sometimes you get paid, sometimes you don't for some reason. I don't know. But it happened, it doubled up so much. So total commissions from August the 17th through April 18th, we had $55,981.96 based on an employee size of 200 employees. You average up and down in that range, that's $31.10. Claudia's part is $41,986.47 or $23.33 PEPM. Plan source fees that she pays out of her pocket, out of that is about $6,950. So her net commission is $35.36.47 or PEPM of about $19. Butch's part, he gets a little bit over there to help her. You can see what his part was, and you see what our part was. Now, I can give you one of these each month, but it's not a report from Blue Cross Blue Shield because they don't furnish that. But I can give you one of these on a spreadsheet every month when we get paid.
And these total commissions are reflective of when we agreed upon a set base salary for brokers. And then we went back to the PEPM and it changed it to 3141, 3110 per employee per month.
She got back with Jan Grief, who's the Blue Cross Blue Shield rep, and says, all right, here's what we're trying to do. What plan have you got that's close to those numbers? And this is a plan that Blue Cross Blue
So
Shield.
you multiply out that per employee per month number, this August 2017, this number is that times our employees. Is that?
Let's say that again.
The 3110 per employee, just say we had 150 employees, that's that amount.
Yeah, you can say
Yes,
it's right
yes.
there.
Okay.
The total commissions that we've earned is 55.9.
Then December 2017, we have a negative $1,895.
That's correct.
How do we have, because I don't believe we've had a negative employee.
That's
We
a
didn't
Blue-
get paid that
That's a
month.
Blue Cross Blue Shield accounting function. We just didn't get paid. I just showed you. I pull from my statement each month what we get paid. We either get paid positive or it's a negative. In December, for Jones County, it was a negative. But if you'll see in March, they made up for it. And that's what we have to watch for. Jonathan Neff can tell you the same thing. Every carrier, they'll 1 month you will not get paid, next month you will be doubled up. You have to watch it on a monthly basis because if there's anybody that can mess up accounting and mess up commissions and mess up premiums, it's the carriers. Not only Blue Cross, but United Healthcare and Aetna and all the rest of them. So all I did here is I pulled what we received, put it on the sheet. That's what it is.
Can I ask a question? PCPM, that's per contract per month.
Per employee per month.
Okay, PC.
What is PC?
Okay, I'm asking, what is PCPM?
I don't know what PCPM
My
is.
understanding is per contract per month.
Well,
Now,
From Blue, is that from the lady from Blue Cross?
well, we got a letter from Ms.
Debbie.
Pope said that y'all were getting,
It's the same thing.
It's the same thing.
just their language.
contract means per member.
okay, we're
policy.
just trying to clarify that. 'cause I
Okay,
mean,
I'm sorry.
You know,
Yeah.
if you figure a PCPM and you figure out everybody we got on the policy, this could be up in the $120-something
No.
range. But that's what I'm clarifying. I
Yes,
want, you know,
yes, per contract is the member,
Is the member.
and
Okay.
that's same as an employee to us.
So you only put 9 months on here because of whenever the contract started. If I multiply by 12, then I'll get the actual annual, which would be close to the
Should-
74,000.
Should be pretty close, yes.
Okay. And how many employees do we actually have in the plan?
Let me see, I've got it written down. Let's see, you've got 90 employee only, 40 employee spouse, 32 family, and 20-something employee children. So.
As of this month.
As of this month.
But it varies
As of this
depending on the number of employees you have. 1 month you're gonna have more, 1 month you're gonna have less.
220-something?
About around 200. It averages. Sometimes it'll be 190. It just depends on turnover, but it averages around 195.
And I put the 200, so if it's 195, that'll change it to
Next month it might be 210, but
a
that's
few
just kind
pennies.
of an average.
That's right. All right, go ahead with your.
Oh, yeah, the reports. I'll run down, I'll try to be brief and run down this.
Go ahead.
Starting in February of 17, I requested reports, claims, comparisons from Blue Cross, from y'all and other surrounding counties to start the renewal process. I received that. Then went over with HR, that information. Then started reviewing reports. Now, I know he's not here anymore, but it was with Chris at the time.
Get the dates.
Oh, March 23rd, reviewed emails, reports with Chris. Again, did that on the 3/27, the possible renewal and stuff of surrounding counties. Then in May, we sat down, reviewed claims history, and reviewed open enrollment and how to handle it. After that, and I don't remember the date, it was later that week, we went in and talked with Jason about that. Then we started open enrollment. Then in July, we had several meetings that we reviewed with HR, the open enrollment, the reports, things that were missing. Then in April, we reviewed August, we reviewed OEI and principal. What that means is any reports, we get those reports, y'all do, of anything that's missing. employees that have skipped something, forgot something, and that we did that almost for a month. It took a long time, but anyway, we met a lot during that time. Then in October, after the turnover and stuff, we had some reviews. I think, with Margie and Shannon a couple of times going over Plan Source, how that works. And I know that was kind of an interim time for y'all, so it wasn't as detailed, but, we went over, how to work Plan Source, what principle was, how to do all that stuff. And then in November, we had several conference calls with Plan Source to review the benefits. Then again in January, Candace Varnado came down. She's with Greater Georgia Life. We had a meeting with her to go over several things. Then we had, I think you all may remember, on February the 5th, we all had that meeting at Chevy's. Those in attendance were Candace Varnado and Debbie Pope, and then several of y'all.
Who?
Oh, Chris Widener, Jonathan Pitts, Sam Kitchens, Wellness Committee members, Jason and Captain Mosteller from the Sheriff's Office, Betty and I. That's when we went over the wellness information, and Candace and Debbie, what they did was they pulled those reports out. Do you remember her talking about that? How if diabetes is high, if, whatever is high, that's how we then try to address things like your wellness committee. What I do, we have that health fair every year. The way I determine, I call Navicent Health, and I have them come in. I talk to the administrator, and I go over with him, these are some things. There's a questionnaire. What do you want to focus on? And I'll say diabetes, BMI, whatever your highest dollar claims are, that's what I review, tell them these are some things I want to focus on. And I have that done every year for free. And that comes from those reports. We did set had the wellness health fair and stuff. Then on February 22nd, we mailed utilization reports to Jason. And then on March 22nd, we had a meeting in Shannon's office. We went over bill reconciliation, Plan Source, how they can do some other things. It was an email that I received that said, can you do, 1095s? Can you do bill reconciliation? Just, numerous things. And that's what that meeting was in regards to. Then on 4/11, we had income verification from Blue Cross Blue Shield sent. 4/18, report of utilization cost from Gary Simmons. That was a lot of the Teladoc stuff too, emailed to Shannon and Jason. Debbie Pope told me and gave me some dates that she emailed reports on 2/27, 3/23, and 4/22/2018. Income verification was hand-delivered to Jason and Chris White, or I think, Chris, you were in the office by Butch Clark.
Now, this is the same report that you got right here. They got it in April.
And then April 27th, email verification of income was sent by Gary. On 4/28, I did get one out of order, I apologize. 4/28/2017, Form 5500 of verification of income was sent to by Blue Cross Blue Shield. 5/2/2018, income verification was sent by Partners Benefit Group. And then again this year in May 4th, Form 55 verification income was sent to Jones County HR. So these are I just wanted to clarify that there has been reports, there has been times of going over it. If you thought that I had not, I just wanted to go over it with you and do this.
Let's be clear though, all the reports in 2017 were prior to a July 1 signing of a new plan,
She
right?
was just showing you what.
I was just showing you some dates.
She was showing you what she did for renewal for the July 1 and then what she's done after July 1.
And I've always gone over those reports in the past with other, the other people that were in place.
I guess I still have an issue with our vote in May of 2017 was to retain the broker with the assurance of accountability and transparency and reporting that we could show the public, we could show the taxpayers that we are using their money. That was one of the first things we heard was, we don't know what y'all are spending our money on. We don't know this. And we vowed to be open book and let people know it. And we asked for reports from them. We didn't hear until about a month ago, maybe 2 months ago, that we can't even get them. And this report shows that it was given on May of 2017 and another 5,500 on May of 2018. I don't understand how we can make good decisions on new policies or new plans without a report in a year, knowing what we've done with an annual report like this. So how do we even, I mean, we understand there might be a 25 or is going to be a 25% increase. How do we reconcile that at this point in the game?
Well, it's already started. You started with a planning committee, and you start, health insurance is a function of sitting down and planning for the new year. Once you get the renewal, you see what the renewal is, and then you start adjusting. You can, and there's several ways you can tweak it. You can tweak deductibles, you can tweak co-pays, you can tweak co-insurance, you can change the co-pays for specialists and ERs and what have you. You can change the different benefits, and those are the things that your broker brings to the table to you. Claudia has got some things now where she's shopped it, made some different pricing things, and has got some ideas and some thoughts where she can get it renewed with maybe for the same dollars. But she has to meet with you, or has to meet with someone. She's called, has not got phone calls returned, and so she's ready to work. But somebody in the county, whoever it's responsible for, has to return the phone calls and be ready and prepared to work with her.
Well, I think that's a little ingenuous to make those statements unless you were sitting on the other end of the phone call. I understand that you're understanding, but I'm trusting my staff too. And that's not the information I'm getting from my staff. So I don't really appreciate justification of this board not having what they asked for from last May. And that is exactly what we asked for, and we don't have it, and I want to know why. And we were in ACCG last week and I talked to Monroe County, Putnam County, and Baldwin County commissioners that have already gotten their renewal and have already decided on their plans. And now we're saying we're not behind the game. We're not behind the 8 ball. I don't understand that. And we've been told that they're self-insured. They don't get the same reports. They can't do this, can't do that. And everything we've been told, I've been told differently by other commissioners. So I'm not sure what to believe anymore, except that I went back and listened to the minutes of the meeting, and I voted that we would retain the same broker at this contracted price, with the stipulation that we would be accountable and transparent to the taxpayers of this county. And that's what I intend to do. And I'm waiting on somebody to explain to me why we hadn't got there and how we are.
I got the renewal, and I did confirm with Blue Cross Blue Shield that, I don't want to misspeak. I don't remember which one of those two counties, but one of their renewal dates is, I believe she said January. The other one, they did get it a few days before me. They start with the lowest renewals, and theirs was minimal, and they go down. She received it on April 16th, worked on it, processed it, and I did not get it from her until April 19th. And so as soon as I got it, I told y'all I got it.
And that's an issue we have across the board, and I think Shaw Hankins will tell you the same thing. We have a tremendous issue with carriers begging for renewals to give us time to work and get things put into place. But historically, carriers will say, well, we're doing the best we can. And we're lucky to get one 60 days out. Anything before 60 days, we're lucky. And you can verify with them and see, y'all get it sooner than that? You're better than we are then. So, that's just what we deal with.
Every commissioner that I talked to had a July 1 deadline on their insurance.
If they're with ACCG, they would have.
Right.
If they're not with ACCG, they could be at a different time.
One did, and
we're with ACCG, so that's the ones I'm talking to.
And that's always a July 1.
Right.
Yeah, I agree.
And those
I think one of them
counties
was-
that are similar in size, similar
Self-insured.
plans, in the pool with ACCG, with the same timeline as we already have their ducks in a row, and we don't.
I do. I'd already shopped it. I was just waiting on the renewal. The day I got the renewal, I sent it to the other carriers, and I've got those. I've got them ready to show you.
You called?
But I was just told it would be after this meeting. And I understand, I mean, that's fine, but I've had them ready. And I've also got your plan design options already ready, to where all I have to do is, just sit down and show it to you.
Claudia, who are you calling that you're not getting a response from?
It was Shannon.
Shannon?
Mhm.
Not Jason, but Shannon the whole time? Okay. Thank you.
Shannon, could you come up here?
Well, first of all, I don't want our staff talked about either. I trust Shannon and all of our staff.
And she may have just been busy. I don't know.
And that's a far cry from somebody saying that they just don't return the calls.
Well, it was a week. It was a week, and I mean,
Well-
she may have been busy. I don't know. And
Excuse me, Shannon, would you like to address that?
The first part where Claudia said that she tried to, that I didn't let you know about a meeting. The meeting you called me about was a meeting for the renewals. It wasn't, that's when I said Jason is at the ACCG in Savannah. It wasn't about a business meeting.
well, when I said when is the commissioners, when am I supposed to meet with them again? I need to get with everybody. And you said I don't know. They're out of town. I'll talk to Jason hopefully by Thursday.
That meeting was about renewals, not about when you were going to come
About
down.
insurance
Right.
and renewals.
And you were in here the last meeting when Sam said he wanted the information. Right?
Yeah,
Okay.
and that's what I was telling you. I had it.
I have given the commissioners every email you've ever sent me, every response I've sent you, every screenshot you've given me, I've given to them. I've given them everything. I'm not trying to not communicate with you or not work with you, but at some point I have to draw a line of when things start getting very unprofessional. I don't feel like I have to be subjected to that.
Well, I apologize.
Thank you, Shannon. Thank you.
Any more questions?
Mr. Kitchen, you got any more questions?
No, I mean, I hadn't got an answer. So
Oh.
we don't get quarterly, monthly, we don't get any reports except once a year. And if
On
we're,
income.
and
From Blue Cross Blue Shield, they give it once a year, and that's a Form 55. I can give you, and I was not aware that I was supposed to give you, but I can give you what we receive on a monthly basis once I receive it. I mean, it'll be a little, here's what we received and here's what it is. It'll be two little numbers, but that means as you can see there, I can do that on a monthly basis. I was never aware that I was supposed to give you that. Because when you look at the plan and the money that's spent, the commissions that a broker makes is built inside of that. You're the only county that I know of that's ever asked for, well, I want to break down and I want to be told exactly to the penny what the broker's making, because it's built into the plan. Now, if you were self-funded and we got different degrees of pots of money, that's one thing, but when you pay Blue Cross Blue Shield, that's it. Blue Cross Blue Shield then pays the broker. But your obligation from the county and what you spend is we've got this benefit, and here's how much it costs. It's just like if you go buy a new car, you pay X amount, you get the invoice for the car. Here's what the car does, but you don't have a breakdown of how much commission the salesman made. Okay?
I understand that, but
And so that's the same way the insurance works.
But if we're sitting down selling a car,
Okay?
and I say I want to know what the options cost, I want to know the breakdown of everything.
Sam, inside your packet is a sheet. Do you recognize this? Right.
Yeah, that's what y'all been getting. That's what y'all got.
It clearly states what your commission is. It doesn't.
Yeah, and y'all got that. Y'all got that.
Right,
You
it's
got
not-
one for,
it's not
you got one
hidden.
for last year and one for this year.
Right, I understand that. I'm not talking about,
That
there's two different,
Right.
there's two different things we're asking for, commissions and reports on our policy.
Right.
The commission, you're saying now that we only get it once a year. We were not told that when we voted on this last year to get quarterly reports. Okay, we can do it. If that is your job, is insurance, and I ask for that, no problem, I can do it. And we vote on it based on that.
Quarterly reports would be a report from Blue Cross Blue Shield
The
on.
content doesn't matter. The fact that we voted to get those reports and we have not got them and have not been told until now that we can't get them and didn't get them is a problem. The fact that we are this late in the game and so there's no way we could change any kind of thoughts on our plans going forward
Sure there is.
until we get to,
Right now, you could sit down tomorrow, or by the end of this week, you could have a plan completely changed. You could have different deductibles, different copays, everything put in place. Blue Cross would give that out. She would be ready. It would all be loaded in Plan Source and all be ready for open enrollment July 1. Sure you can. Starting today, you can do that. We're not building a house. We're just, again, changing deductibles and co-insurance and depending on the plan that y'all want to look at and the cost that you want to do. She's got all of that ready. You probably could sit down and review what she's got and say, okay, this is what I want. And within a matter of 2 or 3 days, she's got it ready to have it ready for open enrollment, and you'll be ready. Because again, you're talking about open enrollment in June for a July 1 effective date. We would love to have it sooner, but it can be done. You're not behind the 8 ball. You're not late. You're not late.
I would beg to differ. This is May the 8th. And if we need to make a decision by June the 1st and today, right now.
You have to make it by June the 1st. Well, what about your committee? Don't you have an insurance committee, or do y'all do it on the
As
board?
our broker, you should know that.
She's the broker.
Do we have an insurance committee?
What we usually do is we meet with whichever commissioner is available, Jason, the HR, and we sit down and we go over it.
So you do have a committee.
This is May the 8th. June 1st, we need to know something.
And a lot of
Am
times,
I the only one that thinks we're behind the 8 ball here? Because everybody that we've talked to at ACCG is good to go.
There's not an issue at all for you to be ready to make a decision and be ready to go by June 1.
We don't know what our options are, and that's the problem.
What I'm saying is, she has it all ready for you. All you got to do is look at it, and it's May the 8th, so that gives you 23 days to look at it and say, this is what I want by June 1.
In prior meetings, we were told, we cannot do this, we cannot do that, we cannot do that. Now we can do this, and we can do that, and we can do this. As far as other counties not doing this, Commissioner Kitchen and I sit through an HR program that we actually had an opportunity to meet with probably one of the top HR people in the state. And we had an open meeting. He said, we're going to open it up to any questions. And Commissioner Kitchen and I asked about insurance and brokerage. And he said, let me tell you what we've done in the past. And I see other counties doing it. You say no other counties doing it? He said, we went to a flat fee base. And let me tell you what you can do. And when he got through, this is where we got the idea. We learned from ACCG. We learned from our neighboring counties what we should be getting and what we should expect. This wasn't something we just came up with. There's several counties within this state that are doing exactly like we're doing. They're getting exactly what we're asking for, and there's no questions asked.
And last year we agreed to a flat fee. Mm-hmm. And y'all came back and said you couldn't do it. We need to do it the old way.
Can Jason explain why did we decide to make that change?
And I think as I recall, it was so.
We'll let you talk.
So we didn't have to cut a check every month, so we converted it into a per employee per month amount. So that it would be included in the premium payment to Blue Cross Blue Shield.
That was not our doing.
But that decision does not allow us to have any reports until an annual report comes out.
That's right. Unless we just make something for you.
Well, hold on. If that decision is you got a check, you'd have a check register that would show how much you paid us each month. I mean, you would be cutting a check. So I mean, whoever your accountant is can say, here's a check for here's a canceled check for $5,500, and this is what they made this month. It's not, that wouldn't be a matter. I mean, we could send you a report and say, look, here's a copy of the check, and we got $5,500, but y'all got it too. We agreed to a $5,500 flat fee per month last year. We didn't change it, y'all changed it. We're standing here today. We agreed to $5,500 again, if that's what y'all can do. But that's y'all's decision. That wasn't our decision.
We agreed to $5,500 a month with reports of transparency and accountability. That's what we agreed to, that I heard.
Now, when you ask reports, when I hear reports, I'm listening. I'm hearing claims reports. What are you?
Every report that we're able to get, so that we know where we are in this stage of the game as we go. I don't like surprises. I don't like getting to a month away from where we got to make a deadline and then be surprised with a 25% increase or a 2% increase, or we're where we need to be. I'd like to know going into it, because if right now if no other options and we got a 25% increase, that's going to be tough for us to figure out.
Well,
And how am I to explain to the taxpayers that voted me into office that there's a possibility of raising taxes, or there's a possibility of cutting services, or this or that, to be able to fund the health care that we provide to our employees, and we didn't know it until now.
Well, let me tell you about. We could give you a claims report if we gave you a claims report, if we could, and I don't know if we about Blue Cross. I don't know if it's quarterly or monthly, but if they gave you, because you're fully insured, if they gave you a claims report, you could get one every week if they could possibly give it to you. But you still don't know what your renewal is going to be until they give you the renewal. That claims report has very little to do with what your renewal is going to be, because you're with ACCG. So they're going to compute and calculate all this other stuff, and claims and renewals are not just based on claims reports. So as far as you've been able to look at a claims report and saying, okay, this claims report, then we're going to have this renewal or that renewal, there's no possible way you can do that.
There's no way that as we're going along, we don't see that this change that could be enacted might help us in this area. We got some high payout claims in this area or that area. I believe that we could look at how we're doing business based on whether it's tracking our claims or tracking our high claims. We talked about diabetes in the wellness program.
She has done that, and that's how she sets up the wellness program.
That's how I set that up.
That's how she sets it up.
And then I send out, or Gary does actually, monthly wellness newsletters. Those go to, I believe, most everybody.
But you set up your wellness program based on those claims. Now, does anybody get those claims reports besides you, or do you get them?
I get them, and then I go over them in the past with whoever, is in.
The meeting we had at Chevy's was, in my opinion, a wellness meeting to talk about how we could get our employees healthier to bring overall claims down.
And that was based off those reports.
It had nothing to do with claims or any of that. It was a wellness meeting.
That's what she was using. She was using these. Where'd they go? She was using these reports. That's how she.
I think what Sam is saying, that meeting that we had at Chevy's is something that we should probably do on a monthly basis.
That's fine.
Or if not a quarterly basis, so that on a monthly basis you see what's going on. You can see areas that we can try to address.
Fine.
Because of, whatever the case may be, due to the number of claims we had, due to, just the overall health of our employees. So we know what's going on, and hopefully we can put some measures in place to try to address it, to make the situation better, so you don't continue to have those claims. So
we'd have to have like a small committee meeting that.
Right.
And it has to be closed.
And private.
Couldn't be any discussion of claims in an open meeting.
Right.
Because of HIPAA regulations.
Mm-hmm.
But those are things that you just adjust them, and we handle it. You say here's what we want, and that's what we do.
But there's no pressure we could put on Blue Cross Blue Shield to get our information sooner than the 60-day window. There's nothing we can do.
We try, she tries, we try, she tries, we beg, we plead, because we also want to get everything entered into PlanSource, which is a Ben admin system. And sometimes it takes us just a little while to get the new rates in, the new benefits, and what have you. And so we beg to get this in so we can get it ready for open enrollment as soon as we can. But that's an ongoing issue with all the carriers as far as we're concerned. But here's the bottom line. I mean, this is really what your decision is. Blue Cross Blue Shield, the rates are going to be the same. Okay. You look at different options and what have you, and then you can look at a different company. If you go look at a different company, you go outside of ACCG, and there's a time period before you can come back in. And we have counties that are doing that. Depends on what we can offer, or what the carriers have and what the counties can afford. So all of those things are the same. All brokers are good. We're a good broker. Shaw Hankins is a good broker. We all do a good job. We do our best. You have a very unique situation here. Claudia has been here, lived here for I don't know how many years, but she has handled y'all's benefits for 17 years. Now, I know you're talking about, I want this claim report and I want that report, and we'll try to get you those. But the biggest thing is she bringing you the benefits that you want to have for your employees? And are your employees satisfied with the service that she is providing? You have a very unique situation with Claudia because she lives here. You're one of her few accounts that she's got. She lives and breathes Jones County. She will go to the hospital and help somebody with a claim. She'll go to their office and help somebody with a claim. They will go to her house and call her in the middle of the night with an issue, and she will get that handled. That's very unique in this world. We got a lot of counties that do not get that service because we don't have a that lives in that county. And I'm sure Jones, they have the same situation. You know, if you live in the county like she does, she's gone down when you had a vacancy, I think, and gone down and helped with HR in the HR with some situations. She does whatever she needs to do to help you. Now, the key is we can do everything, bring everything to you that anybody else can. The bottom line is do you want service that you've been getting for 17 years as far as the employees are concerned? Or do you want to make a change? And that's the bottom line. If you make a change, you'll be like we are in some instances. Your employees will deal with whoever the other broker has on the other line. Maybe an agent, maybe a CRM. There'll be a number. There'll be an 800 number or a 404 number, or they can call a local number, her local cell phone, or they can go to her house. But as far as the benefits are going to be the same. Service is going to be different. And the service that really counts is your employees. How are your employees handled? How are they serviced? Are they satisfied? Are they tickled with what she does? Now, other things that we do, and one thing that I brought to her last year, I said, I want to make sure that every employee, every spouse, and every child benefits from you being the broker. And that's hard to do. Because even if you bring a Blue Cross Blue Shield plan in and you're paying X amount for the employee and y'all do a tremendous job with it, you got some employees that still may not take it because they can't afford it. They certainly can't take it on their family or spouse because they can't afford it. And so I said, well, let's make sure that we have a benefit for everybody. And that's the reason we put in last year Teladoc and our Teladoc package. Your cost on Teladoc, if you want to talk to your employees or talk to your county people about it, and you talk about wellness and maybe controlling some claims, let's look at this. This is a 9-month utilization report. I can get this to you every month if you want to read it. Hope I got enough. I can look at it. Well, I'm going to keep going. Let's see if I'm lucky. I'm going to be lucky.
Thank you.
So through the first of all, your cost on this is going to be, your annual cost is going to be about, let's see, $9.95 a month per employee times however many employees. So it's going to be about $21,000 is your total annual cost of this benefit. Okay, through the first 9 months, we saved you $73,137. And when I say we saved you, we saved Blue Cross Blue Shield, and we saved your employees. How did we save your employees? We saved them in co-pays, we saved them in deductibles that they'd had to spend, and co-insurance. Okay, and what they do when they have an 800 number that they call in and they talk to a board certified state licensed doctor. That doctor will talk to them. Everybody in the family is covered. Employee, spouse, all the children, everybody. They call that 800 number, that board certified doctor will call back, and like this time, the average callback time was 4.8 minutes. There's one 5 minutes, what have you, but within less than 5-6 minutes, they're talking to a doctor. That doctor will talk to them about their situation, and their cost to talk to that doctor is zero. No cost. Okay? Now, if they need, the doctor says, well, you need a prescription, where do you want the prescription called in? He or she will call that prescription in. They'll have to pay for their prescription when they get it, but the cost again to talk to that doctor and get that prescription is zero. So in July of last year was your first month we got started. And if you look at the first month, we only saved $764. And what we do is we ask them when they call in, where would you be if you were not talking to us? Would you be at a primary care physician? Would you be at a specialist? Would you be at an urgent care, or would you be in the ER? Or would you just not even be getting any treatment right now? And so in July, just getting started, everybody just getting used to it, we only saved $764. The top diagnosis was acute bronchitis, pharyngitis, sinusitis, yeast infection, and cough. Those were the 5 top diagnoses in July. We'll quickly go through this, but in August, we saved $2,292. In September, we saved $3,629. In October, we saved $10,288. In November, $11,625. In December 7th, and that's getting wintertime. It's cold. People get sick. They got coughs. And again, the top 5 diagnosis was pharyngitis, which is a common cold, acute respiratory infection, acute sinusitis, rash and other nonspecific skin things, and other issues. So in December, we saved $17,902. January, back to $764. Everybody seemed to be well that month. And then in February, $12,554, and in March, $13,318. If you consider co-pays, co-insurance, and deductibles, about half of that money probably is in your employees' pockets. They didn't have to pay that doctor a co-pay. They didn't have to pay that $100 bill at their urgent care. They didn't have to pay that $150 bill or whatever deductible y'all have at the ER. They didn't have to do that. They were able to keep that money in their pocket.
Mr. Chair, Jason wanted to say something.
All right.
Mr. Chairman, one question about this, and I emailed this to them some weeks back. If you look on the first page here, it shows in July 2017 we had a total of 5 consultations, and we saved $764. So if you take those 5 consultations, and then at the top of the next page there were 9 consultations in August, that's a total of 14, and the savings had inched up to $22.92.
That was 14 in the month of August. That's right.
No. That's year-to-date summary. 14 is year-to-date summary.
Yeah, year-to-date. All right.
And so the $22.92 savings amount is year-to-date. So over on the next page, you add 9 consultations in September.
Okay, I see what your point is.
And so the total savings at the end of September was $3,629. Once you get over to December, we had a total of 46 consultations, and the total savings was $17,902. And then it starts over in January, so you've got January, February, March.
Well, we didn't save as much as I thought.
So it's about $30,000 in savings rather than the $73,000 amount there on the front.
All right, I misread that. Yep.
And the plan costs, based on the number of people who use it, 71 out of 243, it's almost $300 a person. And I'm just going to touch on service. If I'm making that level of connections to employees, which is what you guys are saying she does, I think my response rate would be higher than 28%, especially if this is so great. So there's a huge opportunity to reach the other 170 employees that were not touched, who probably could have benefited, who probably spent more money. That service that you're talking about. And those are part of my concerns. We've not had the service from the very beginning. And I don't want to go back 13 years because I wasn't here that long. I've been here 6 years. And some of the same data and questions are the same things that I've had. And my concerns are employees' plans are not better now than what they were when I first got here. Our co-pays are higher. Our family contributions are higher. And I think as a result of that, overall, we don't have the best plan for our employees. And I also believe that we're spending too much for our policy. And considering that we're about to experience a 25% increase, which is almost equivalent to a $500,000, it has to come from some place. And that's real. And I don't want to find that out, like Sam said, in May. I'm the least of your advocates. And when they decided that this is the direction they wanted to go on, it's up to them. And at the end of the day, they got exactly what they deserved and what they bought. They bought you guys who did not fulfill the requirement that was set out last year. And that's the big issue. Can somebody else do the job? And you pointed it out. You said, yes, they could. And Mr. Chair, not to belabor this any further, I'd rather give somebody else a shot at doing this and doing a better job. And my motion is going to be that
We're going to hold off on motion for one reason.
Okay.
We got several people signed in that would like to speak. We hardly ever get anybody sign in on the agenda item. So we're going to give the audience the opportunity. We'll see if any other commissioners got any more questions. And I'm going to let Mr. Kitchens continue on with the direction.
fair enough. I'm ready.
One thing on the teledoc.
What I'd like to address.
Okay, go ahead.
What I heard was, well, you've hired these guys and our benefits aren't any better. Well, the benefits aren't driven by us. The benefits are driven by the industry. It's 10 years ago, yes, deductibles were different, co-pays were different, insurance was different, rates were a lot less. And the reason your co-pays, your deductibles and everything have gone up is a function of trying to control your cost. The only way, healthcare cost, the average healthcare increase on an average is about 10% a year.
But we're not about to do anything different to our plan, but yet we're going to experience a 25% increase.
Well, maybe not.
I'm just saying, okay.
Yeah, and maybe not, because she has some plans where you will not experience that you haven't seen yet. The 25% increase was the first renewal that we got back, and that's when she starts working. We've had some 60% increases, some 100% increases with other groups, and we start working it down. And we start working and negotiating and trying to get it down. And I'm not so sure, and I don't think you'll end up with a 25% increase this year. But that was the first renewal rate that we got from Blue Cross Blue Shield. They throw it out there, and then we have to start shopping and negotiating. And then if we get to the point where we have to change. We had a hospital up in North Georgia had a 70% increase. We changed the co-insurance. We looked, and there was only a very few people, maybe 5% of the people that were utilizing the maximum. We changed the co-insurance from 80 to 70, and they got a decrease. We went from 70 increase to a decrease. So those are the things that you do, but every broker does that, including Claudia. So
we don't have that information, Mr. Chair. Again, I hate to belabor it. I know you got people that have to sign in, so
you just haven't seen
I'm good.
If we can't, Commissioner Robertson, have you got anything you want to?
No, sir, I've heard enough.
Commissioner Pitt?
Not at this time, Chairman.
Commissioner Kitchens? We thank you. We'll give,
thank you.
So one thing I wanted to add real quick about the teledoc, it is new this year. This is the first year, which is typically your lowest. And we have had numerous meetings to enroll people and educate them afterwards. You had one at Public Works, right?
We went to every department and had meetings to make them, show them how to use it.
Put it on their phone.
Send them in, give them the numbers, and we taught them how to use it. And it's a new program, and it takes a while to grow. It grows slow. People get used to using it. It gets better every year because they just actually forget about it. And that's why we kept having meetings to keep reminding them of it.
And as time goes on and this one uses it and tells this one, and we continue to have meetings, it should grow.
All right. Can every broker sell or utilize Access Teledoc?
That I don't know.
Okay.
What do you ask, Chloe?
Can all brokers do teledoc?
Well, there's different. There's MD, live MD, and health issues.
They may do something.
Okay.
Yeah.
All right. Thank you. Proprietary program?
Right, right.
Fair enough. Thank you.
All right, thank you very much. Commissioner Kitchens, you want to continue on? Well, may we invite Joe Hankins forward to give us a presentation? Or what is y'all's thought?
It's only fair. If you
Okay.
want to say something.
Joe Hankins, would y'all like to come forward and talk with us?
Thank you.
Well, again, my name is Jonathan Shaw. You can hear me? Okay. Jonathan Shaw with Shaw Hankins. Thank you so much again for this opportunity to speak with you today. This is a very lengthy presentation. A lot of it, is kind of a review for those of you that were part of our, finalist presentation last year. But there are a few things that I certainly would like to, to point out. Page 4, again, want to stress our presence here, specifically in this area. Again, as Chairman Widener alluded to, there are several clients of similar size within the ACCG pool that we've had for several years that, fortunately, with the timing of the conference, you were able to speak with, in regards to the service, in regards to the consulting services, the reporting, the customer service for employees, and thankfully they were able to tell you better than us, kind of what their experience has been. What gives us a lot of power is this next page is you are a part of a team. And, it goes back to, the foundation of Shaw Hankins. What my grandfather's #1 priority was treat every client like their family. And that's the foundation. That has been the crux of what has allowed us to be so successful, specifically here, within public entities, because we understand the challenges. We understand the employees at Public Works. We understand the sheriff's office, multiple shift changes. We understand the need for that personal touch, that accessibility, that availability, the ability to assist with those very important claims issues that come in right away that are urgent. Maybe they're at a pharmacy, need a prescription, have lost their card. They have access to our team, at the touch of a phone. They're not calling a farmed out, 800 number to some call center overseas. It is in our central location in Marietta, Georgia, and at all times, you have access to 4 to 6 of our customer service reps on the other side of the line that can help instantaneously. They're not people answering the phone. They're not taking messages. They're there to work. And they are the ones that in real time can take information, can work on that information, can work directly with the carriers. In this instance, Blue Cross Blue Shield, we are a preferred broker in the top 10 in the state. So we have access to our own specific premier, group of customer service representatives. So we have a specialized team, can get things done quicker, faster, more efficiently, more effectively, which ultimately, benefits your employees. There are situations, certainly, where we need to be here. And again, as a part of the team, your account managers in Stockbridge, I'm in Statesboro, and we're already in this area. We work with Jones County Schools, we work with Putnam, we work with Lamar and Monroe and Macon Water Authority. So it's very much part of our standard operating procedure to be here, to be around, to be accessible. And I can assure you, as the rest of our clients, that there will not be any type of drop off in the level of service accessibility that your employees are receiving. But certainly from what I'm hearing, the experience from the consultative part of our value proposition will be much higher. I do disagree with a couple of points, respectfully, but I do think that tracking and understanding the claims on a monthly basis is very important and very indicative of what is to come. Can we give you a specific renewal to the nose? No. But we want to know monthly. We want to know specifically for those high claimants, are they closed? Is it a $10,000 a month prescription? Is it something that's ongoing? Does they hit the pooling point? There's a whole benefit that we need to consider if we were to leave the ACCG pool, is that stop loss protection, if you will, that you basically forfeit. But you need to be tracking all of these things. And we don't rely on Blue Cross to provide us with anything. We're not waiting on quarterly reports or annual reports, aside from the 5,500 that is available annually that list out the compensation. But we have access to the Blue Cross system. We are pulling the claims information ourselves, specific data points that we find very important, that certainly give a very good indicator of what renewals can look like. To top that off, because of our presence, because of the large number of ACCG clients we work with, we have a pre-renewal meeting with Blue Cross ACCG in March and specifically address each and every one of our groups. So we, at that point, identify, okay, this is where we are in the pooling point. This is a claimant we're concerned about. Looking at this and a portion of the information, how many of the ER visits were avoidable? Let's link that up with the teledoc. Let's see, okay, are these visits truly that were avoidable? Is there some more room to capture these avoidable ER visits? How many claims were lifestyle related? There's so many data points and bits of information that you can use to project your renewal, but also make sound strategic plans for a future strategy, a proactive strategy. And as a outsider, from what I've heard, up to this point, it has been very, reactive. And it's been a matter of, okay, we get the renewal, here it is. How can we slowly shift some of the cost to the employees in the form of copays or deductibles, what have you. And a deductible of $3,500, which I believe you are now, is certainly well above what we're accustomed to with our county government employees, client groups. So we have the data there. Again, I hear rumbling, but again, to keep it as professional as possible, I've no doubt that we can help you. Y'all do have a tough decision. I recognize that. It's always tough, especially when it's a long relationship, to take that step to a firm like Shaw Hankins that is not here, domiciled in Gray or in Jones County. But again, I ask you to look to your peers who had it to make that same choice. And I think, unanimously, I feel like it was a very positive, very impactful decision for them in their county. So with that, I very much appreciate your time, and I'm open to any questions that any of you may have.
We'll start, Commissioner Kitchen.
Yeah, of the 6 that you listed here, how many of them are ready for their renewal at this point?
So I met with Putnam at the ACCG conference, and they had their renewal. They're meeting 1.5%. Meriwether is set. All of these were delivered actually the day before, as I mentioned, I guess 2 meetings ago, when they were saying it would be May. We had those, the day before. The last one to finalize I have is actually tomorrow for Lamar County. Is the last one, physical meeting where they're, voting it in. But that's on the timeline that we set out with them and can accommodate the education, the enrollment, the actual face-to-face time we provide with all of our clients' employees. They're all very much ahead of, target.
And they're on the same July 1 deadline as we are?
Correct. Yes, sir. On that, Macon Water Authority is not on a July 1. Monroe County is not on a July 1. And Jones County Schools, obviously, is with State Health Benefit Plan, but we do their ancillary benefits January 1.
Commissioner Pitt?
Yes. So can you explain, how can you guys get the renewals and the information, I guess, earlier than Partners Benefits Group. Can you explain that?
I guess the squeaky wheel gets the grease.
Okay.
You know, we're on them. We have the data. We're tracking the data. We have our own actuarial team analyzing the data, so we keep them honest.
Right.
You know, so they want to get out in front of us marketing it, and they know they're going to have to give us a reasonable renewal accustomed to, you know, that lines up with the claims history,
Right.
and they know we're going to shop it out and keep them honest. So that's with our working relationship there, having that many specific, you know, clients within that pool. You know, obviously they're trying to, you know, keep our relationship strong and treat us for, you know, the preferred partner that we are.
Right. And then are you currently meeting, I guess, monthly or quarterly with some of your clients, Monroe, Putnam, Marietta, Lamar, to review claims, make recommendations and suggestions?
We provide monthly claims analysis, and we meet quarterly, specific to the claims. And then in there's a pre-renewal, post-renewal type meetings where we get in line with the timelines and different, you know, other projects we may be managing throughout the year. But communication is constant. It's very clear, and it's very easy to understand, and we're very much tracking it. You know, we have a whole team that is, all they do is track, analyze, put it in a graph, and make it easy for everybody to understand. And in the back of your books there is an example of a generic version of, you know, what our reporting, you know, does and will look like.
Which page would that be, Jonathan?
It starts, I think did they put a blue sheet divider?
After the blue sheet.
Yes, after the blue sheet.
Okay.
Mm-hmm. Yes, sir. So we look at a lot of things. Go ahead, Ty.
I'm Todd Hooper, consultant as well on the case, and I'm the consultant with Jones County Schools for Shaw Hankins as well. What Shaw Hankins does from a perspective, I mean, you just get a small glimpse here, but it's a very orchestrated planned process. What you see there with the monthly reporting that we provide, there is a plan that we put out. It's a timeline of renewal that we provide our clients. So the renewal, the meetings, the RFP process, if it's going to be marketed, the open enrollment dates, all those things, education meetings are planned with administration well in advance. Now, when you talk about these monthly reports that was mentioned here, and I think both of these gentlemen, I think I picked up on what they were getting at. And I spent 16 years as a CFO with two different governmental entities. And one of the things you hate to do, and I'm going to use manufacturing as a process, you generally have an idea about your inputs. But when it comes to your benefits, it's always that surprise, and you feel like you're helpless about it. Having these monthly reports that we provide, we feel like we bring administration and the entities into the knowledge of how this thing is progressing. And as you mentioned, we want to look at the reports from the standpoint of what are your high-cost claimants. There's also another report out there that indicates what are your top drugs that's being used. And it identifies those types of conditions that are associated with it, and was referred to in the previous presentation. Those are things we look at, and we have those conversations. There are some high-cost claimants you can't avoid, but there are some that you can. But the bigger piece of it, and I think you may see it in some of that reporting if it's provided there, we don't only just say, here's your claims for the month, but we break it out and we look at it from a standpoint of, here's your medical utilization, but here's your pharmacy utilization. And what we're seeing in the industry, so to speak, and I'm sure you hear it, is the pharmacy is the big piece driving it. So as we go through the year, we have those conversations, and as you'll find, Blue Cross Blue Shield this year has a new formulary that they've put out there. So we look at it from a standpoint of, well, this new formulary, how many people are using some of the drugs that are going to get a disruption? We do a email, a mail, and a phone call to those individuals to let them know what's going on there. But again, we don't want you to get to a point where you're within the 60-day window and you're like, oh my gosh, what are we doing? We want you to be familiar with what's driving your cost all throughout the year so you can react, you can plan accordingly, and with an employee benefits committee and a wellness team, you adjust that as you can. But again, here's a bigger piece, and this is coming from my finance background. When you look at this, it's insurance. It's a decision you have to make. It's a decision administration has to design along with the broker, and then the employees are at the behest of what happens. But it's one of the biggest budget pieces you have. And it was interesting, before we came in here, I was sharing with Jonathan, It looked like a half a meal was about 500,000. I noticed like your millage maybe it went up 2 meals and values had went down. From my background, we're not just insurance consultants. We look at it from a standpoint of how can we be a part of the solution that fits into one of the largest budget drivers that you have. And we want to do that by being very progressive. We want to be engaged to the point that the communication comes to you, so that as you go throughout the year, if you have employees that are having situations or you have constituents that are having questions, you do have that ability to be informed, transparent, and you can communicate with them pretty knowledgeably. Again, we don't want it to be a huge surprise. As was mentioned, as we go through some of our clients, we typically look at a trend. We look at the loss ratios. We look at the budget and claims to the point that we're able to inform administration pretty much of where this is going. Can you turn it around and get your plan back in line before the end of the year? You don't have a lot of control over claims, but you certainly can have a pretty good indication of what the renewal could be. But at the same point in time, when you're looking and you're running very well and you get a carrier that comes back and gives you a 12, 15% increase, you have the questions before we even have them. Now, that's not to say, and it's just as he mentioned earlier, there's a lot of things that drive those claims. Obviously, your claims experience, but you have pooled claims experience. But then it does come back to a lot of different types of utilization that's out there. But again, we look at it at Shaw Hankins as being a total process of being a solutions-oriented company, not just looking at it from an insurance standpoint.
Good. And then get to the last question I had. Well, it was mentioned that our deductible may be $3,500, and that may be higher than some other counties, pretty much our size. So I guess from comparing other counties, our size, do you feel like you could get that deductible down and still be in that budget? Or just that's not a.
It's impossible
it's
for me
impossible
to answer that question. Okay. I would say at this stage, right now, it'd be very difficult. You know, right now we got to start, and it's a very slow movement down. But like we did with Meriwether and Putnam this year, you know, with a true comprehensive wellness program. You know, we delivered a -10 to Meriwether a couple of years ago, a 1% increase this year with Putnam. You know, this is their second year in a Shaw Hankins, you know, wellness program. And that's the solution. You know, that's a proactive approach to a true, again, I say the word comprehensive wellness program. You know, what you've done now is developed a culture. All these things are so important, you know, because it's very much a process. But in terms of, you know, truly investing in a program that you can expect an ROI, you know, that's something we would certainly want to talk to you about, and, you know, is certainly a recommendation right now in terms of a long-term solution to this problem that's going to get, you know, sounds like a, you know, a lot more difficult with this renewal. So that is the solution in a nutshell.
Jonathan, excuse me, but the deductible was $2,500, not $3,500.
Okay, excuse me. Right. Okay. And then the last question, Jeremy, is I guess the customer service that some of our employees are, I guess, accustomed to or used to. Like I said, they can call Claudia at home. She's coming to the hospital, going above and beyond. I guess what would we expect from a Shaw Hankins when John calls her from the hospital, I got an issue? Can you give us a little example of what we could expect from a Shaw Hankins
sure.
rep?
So probably the only service would be the after-hours on-site services that I believe are being received right now. No, we won't be able to go physically to the hospital, as unfortunate as that is. But at the time an individual is in the hospital, you know, there's very little that can be done from an insurance service perspective until that claim is submitted, filed, processed. You know, that's when, you know, we can actually do a lot of things there. Now, everybody gets my information. Everybody gets my my card, which has my cell. I take hours, as anyone in this industry, I think. Saturdays, you know, Sundays, weekends, you know, after hours. So certainly we'll be available and accessible and ready, you know, to help. But the thing is with us is it's not just one person. If I'm in a meeting, you know, they can't get me, they got Todd. You know, if me and Todd are here, they have, you know, James, he's your account manager. You know, there's very much a design to our company to make sure we're accessible all the time through normal working business hours.
Good. Thank you, Chairman.
Commissioner Pitts, you was asking about deductibles. Putnam County, I believe, is at a $500 deductible, but they've got an HRA in place. Is that correct?
That's correct, yes, sir.
And, I've been asking about these HRAs and how they work. We were told that they were partially insured and whatnot, but this is the type of thing I 2 years in a row now, we've learned of ideas that we can go in there and lower our employees' deductibles and I mean, just ideas in general that can help us, both employees, our overhead, everything that I've been asking and questioning, and that's $500. That I think we put a lot of smiles on a lot of employees' face. I mean, we're not going to be able to get to it this year, but it's something we can work toward. And Putnam County is one of when they went with Shaw Hankins, they were in the same boat we were, exact same boat we were. I think they had a local broker. They were faced with an astronomical increase, and they said that it was a hard decision, but when they made it, that they were able to sit down there and salvage what they had. They had a lot of great ideas. They used their top 10 rating to pull in different areas. So, I mean, it's everyone I've talked with, I went to randomly calling just, again, 2 years in a row. If you look at our May 2nd meeting and then look at the one we had 3 weeks ago, it's almost verbatim from meeting after meeting as far as what we found we should be getting and what we can get. And it was ironic that several ones I called, I asked them, and it was, Shaw Hankins was it. But, we had several good brokers here last year that all, put on great presentations, told us what they could do. And, but just to give you a heads up on
one more question.
Sure, go one more question.
One more question, Mr. Chairman. Could you guys comment on the potential savings that you guys have saved Putnam County since you've been working with them over the past year, 2 years or so?
Can you repeat that question?
Can you guys comment on the savings that you guys have been able to save Putnam County over the past 2 or 3 years, however long you guys have been working with them?
Sure, it's been a direct impact of the wellness program.
Okay,
we've identified, again, there's a lot of analysis that goes in when we use a third-party vendor, but we're tracking what's called a cohort analysis. But everybody, has a biometric screening. We get some panels. We're able to, basically stratify across the group. X percentage are high risk with blood pressure, X percentage are moderate low. And again, through our program and communication, we're steadily seeing those numbers of high risk go to moderate to low, which has very much correlates with a negative, claims trend. What impacted us there, what really hurt is there was one individual that had a $15,000 a month prescription drug that, really, you look at those graphs, that's unfortunate, or we would have had even, more luck. But there's always going to be that high claimant. There's always going to be things that you cannot control. That's what insurance is for. But there are certainly a whole lot of things that are in our control, that we are in, power and control over. And one of those is our health. That's why they call preventive visits, right? Because you identify early. Right. They're less likely to become an issue down the road.
Okay.
Yes, sir.
And the last question I would ask is the HRA plan that the chairman is familiar with. Would that be a good plan for us to implement, or can you comment on that at all?
Yes, sir. It's a no-brainer.
Okay.
In that effect, again, there's some analysis we need to look at to establish what your break-even point would be.
Yeah.
But without saying it's impossible to say that, but we have found that an HRA specifically at a $2,500 deductible, you're going to get a big enough return to where it's a no-brain situation that the county and the employees win. Communication's so important if you're going to do an HRA. Your employees at every level, have to understand what's an EOB, what's a bill, what do I owe, how do I do it. There's a big communication piece to make that work. But yes, sir, I would say it makes a lot of sense.
Thank you, Mr. Chairman.
Thank you. Commissioner Robinson?
I don't have anything.
Commissioner Martin?
So, just out of curiosity, Board of Ed deductible, can you share that?
Cool. So that's done through state health. So they have plans available through Blue Cross, United Healthcare, and Kaiser, depending on the area. And then it's anywhere from a $1,500 to $2,500 deductible with Blue Cross.
And that's because the number of employees and the choices plan
That's the
types?
entire state of Georgia.
Okay.
Yes, sir.
All right.
What they have is what you call a metal plan: gold, bronze, silver. And what you find typically is most people take a silver plan. Gold, obviously, if you're high maintenance,
Right.
you want a predictable budget. The bronze is going to be more of like a health savings account. There's only about 1% of the population, 1.5% that participate.
Gotcha. Just as a little toot of your horn, we asked for some basic data, and you shared 7 different clients, and you tracked 36 months of data, which is important for all parties here and for our constituents that we serve. Do we always have access to this? Is it going to be a dashboard access? Is it an email report?
It's an email report we send at any time. We can go into the system and pull at will.
Okay. And you got monthly medical claims, you got RX claims. Will we also get an indicator of how you use medicines? I know you talked about it, but will we have that?
Yes, sir. We can do a utilization report, and that's available, again, really to any broker. That's not something that is terribly difficult to attain.
Do we have any influence over the formulary or the choices of medicines that we include? Because I've heard some employees say, oh, they used to cover this, now they don't.
Yeah, no, sir. And it's going to get more than likely worse this year. Across the ACCG pool, they're moving all plans to the Blue Essential formulary. Y'all may or may not have implemented it last year, but this year it's mandatory. And it's definitely some, much heavier restrictions on your prescriptions.
So if you see that in a plan, in our previous plan that we're using, especially if we're outside of the pool, will you make a recommendation, hey, maybe that's not a good idea to enter the pool or to stay outside?
Yes, sir. All those things are going to be taken very much into consideration. Now, when you're when you're fully insured, we are not able to customize a formulary. The only way you can customize a formulary is if you do, in fact, go self-funded. So unfortunately, you don't have any option in terms of what your formulary will be with Blue Cross this year. It is going to be the Blue Essential. And it's important, again, to know what drugs are impacted, how many employees, and make sure you're ready for that at open enrollment to communicate that ahead of time, prior to that surprise at the pharmacy. Hey, I got this drug. They used to cover it. They're making me take this generic that doesn't work. I need this brand name. What do I do in that situation? So you go to your doctor, you get a prior authorization. This is how you file the appeal. This is the number. You want to make sure you stay, kind of out in front of those things.
And if you see that, I'm sure you'll be making a recommendation to us, hey, you probably want to go this way because most of your employees are on these particular types of meds.
Correct. Yes, sir. That's prescription utilization is a big part of what we're able to do from a consultative.
An example of that would be like what you call the Nexiums, the proton inhibitors. A lot of times you can get those over the counter cheaper than the pharmacy.
Gotcha.
Flonase, a lot of times now you can get that as well. But like he said, whenever it's inside the Blue Cross Blue Shield, we don't have control over that formulary. However, to the point you made, and I think I might have mentioned it earlier, we've got a potential client. I know that we asked Blue Cross Blue Shield with this essential formulary, what's the impact? They came back, you got 28 individuals that this is going to impact, and we're about to have the conversation with them, not the employee. Blue Cross Blue Shield does that because they don't share that with them.
Fair enough. In the past, when I used to be a part of making plan selections, I used to see costs to buy down the program or the benefit or the deductible, right? So if we wanted to pay more on behalf of our employees, we could do that to help reduce the deductible?
Correct. That's the HRA. That's another way to term that.
Yeah, I think it was about 5 years ago was the last time I saw that. That versus wellness program incentives, which do you see being a better opportunity for us?
You want to tie those together.
Okay.
Now, so HRA is more or less kind of a quick fix for this year. It's kind of going to help ease the burden of this increase. But wellness is the solution for, again, why those counties like Putnam 3 years down the road are saying this was such a good thing. Because that is, again, the only direction we can go and be proactive on this thing. Or again, 3 years, 5 years down the road, we're going, how are we going to fund it? How are we going to fund this $1.9 million, $2.4 million line item, in a reactive manner?
Are we allowed, or do we gain any competitive advantage by being in a similar pool? I know we're not going to be in a similar pool as the Board of Ed, but even going cross-plan challenges. Geico a few years back gave everybody those bands, and they did some competitive stuff, and people got healthy. Do we have some of those opportunities to incentivize counties? Thumbs up. That's a good sign.
Yes, sir. I mean,
Okay.
you're dead on with where this industry is going.
Okay.
Employee engagement is critical. Obviously, you have different people that respond differently. You got the younger people, they love these devices. You got older, experienced people that may not be in tune with carrying those devices. But certainly, we engage with the wellness committee to evaluate what fits your culture.
Very good. Constituent a couple weeks ago said that they called an ambulance service, didn't know that Jones County did or didn't have one, didn't get a response. Do we have any solutions for ambulance versus Uber or Lyft options?
No, sir.
They asked me to ask, so I'm asking. All right.
Well,
We know some communities have explored that, because obviously if somebody's bearing the brunt of that, Uber is definitely cheaper than an ambulance.
Sure.
And maybe more responsive. I don't know. And lastly, transparency. I mean, we talked about reports, we talked about numbers. Our employees deserve transparency. They should see the car that they're buying up front. Do they have some clear opportunity to view that on a regular basis, or is it just through the report?
It's however you would like us to do it, so we can accommodate any structure, any transparency, any model, any reporting you want to see. Thankfully we have a team, assigned to do those very activities every day. So it's just a matter of communication, understanding your expectations, and yes, sir, I mean, we can accommodate it.
And lastly, the five of us normally pick with some feedback from department heads. Is there a way employees can actually see the plan options and we could poll them so they understand what they're getting? Because we pick it and they pay for it.
Yeah, we can do an employee survey. There's all kinds of different resources we can have depending on, how you want to communicate that to the employees. But yes, sir, we do. I mean, Survey Monkey, it's the set up very, accessible program that we can, design and track, however you want to, poll the employees. That's something we can do very quickly.
One of the things that we do is we have what we call a 7-step process. And it really comes back to administration and this board, how you want to approach that. Some of the best plans and some of our best relationships is where we have engagement with the council or the commission through the administration and a benefits committee. And I'll give you an example of how that is really successful. On one particular case, there's an employee benefits committee that's usually made up of department heads. That committee will meet 4 times a year. They may talk about retirement, they may talk about pay, and then they also may talk about insurance as well. But with that being said, we come to that committee, we talk about claims, not on a breakdown level, but just like what you've seen here, so they know, and they're your best ambassadors to your employees because they work with them every day and they have those discussions. But then what happens is we get into the renewal process. Obviously, we're working with administration, and administration is working with us to work on different plan designs, and we get it narrowed down to, let's just say there's 3 designs out there. We come back, we meet with that employee benefits committee. That committee has input. They also have the ability to survey the remainder of the staff. Now, obviously, there's other pressures that are involved too, but again, that's kind of how that works. We've seen that be pretty successful. And then what happens whenever you are adopting the plan for the year, typically 1 or 2 of the individuals from that benefits committee would be at that meeting just in case you had questions about the process to make sure it was fair and transparent, but also any input that they would have as well. But again, we find that to be very successful.
And final question, you're the rep for the Board of Ed?
Yes.
Jones County Board of Ed. Have you ever been at the hospital or anywhere for a patient or client?
No.
All right. Did anybody complain?
No.
All right. Thank you.
Commissioner Martin, Putnam County's got a 62% participation rate on their wellness program.
Excellent.
And it's doing great. Any more questions? We want to thank you very much. We're going to open the floor up. We've had 3 people have signed in for citizen comments. We're going to give them opportunity. Ms. Terry, would you like to come forward? Nobody signed ahead of you, so Ms. Terry Deason would like to come forward and speak about her insurance concerns or input. If we can, we're gonna try to keep it to, 3 minutes.
Sure.
I'm not gonna put a stopwatch on you, but just try to help us out.
Frank will. Don't worry about it. Terry Denson, 2714 Old Gray Highway, Macon, Georgia, 31211. Thank you, Mr. Chairman. I'm not going to get into different coverages or things like that because it's complicated and I trust your decision on it. My concern was with what I was hearing about going back and giving competitors an opportunity to meet the lowest bid. I don't think that's right. I don't think that's fair. I don't think that's businesslike. The board rejected local preference, and I think that was a good decision. I support it. And you did it because you wanted people to come in and compete for your business, give you the best service, the best price, the best product. You've required the department heads to get at least 3 bids, if they can, on things they're purchasing, and I support that. Once again, that promotes competition, good product, good service. You're not being taken advantage of, and you should do that each and every time with each and every product or service that you're purchasing with taxpayer money. I've never heard of a bidding process being reopened to give the second or third lowest bidder an opportunity to match the lower bidder. I've never heard of that. That defeats the whole process. You don't have local preference through an ordinance, but if you do this, you're going to have local preference through practice, and one is just as bad as the other. And I'm afraid if you start this, people aren't going to come in and bid on anything. Why should they? It's a waste of their time and money. Time is money in the business world, and people are used to competing and bidding, and sometimes they'll get the job and sometimes they won't. That's just how it works. But I thank you for the opportunity, and I think you've had a good meeting.
Ms. Terry, real quick, I think if records were right, Shaw Hankins was actually the lowest bid on our last proposal. So I don't know what type, I just wondered, but I was wondering about that.
She's making reference to Jonathan asking them to come back.
Oh,
after.
okay,
Yeah.
okay, I'm sorry. All right, thank you very much.
And Chairman, I just want to clarify, I don't think we opened up any bids. I think what we've done is all of the brokers that submitted bids last year acknowledged that they would hold their prices that they submitted last year for this year as well.
That's great.
So,
All right, well, I was confused. I thank you for steering me in the right direction, Commissioner Martin. Mr. John Wood, you'd like to come forward?
John Wood, Olive Green Road. I've been in business 25 years. It comes down to simple nuts and bolts of doing your books. You got vendor A, vendor B. Vendor B is lower, vendor A is a little bit higher. Vendor A is not supplying the reports and documentation that you've requested numerous times. That's a strike. Vendor B, you've talked to competition or their clients. Their clients are happy, their clients are getting their normal reports, everything they've asked for. There's no complaints over here. And at the end of the day, the employees are the most important, that they get the best plan possible. Because if you look, and on top of that, if you look after the pennies, the dollars are going to take care of themselves. It comes down to our tax money.
All right, thank you very much. Mr. Tom Payne?
Tom Payne, 242 Hitchley Road, Ray, Georgia. I think Mr. Wood pretty much summed me up, but I've been about 4 years listening to this insurance fight go on. I'm glad to see y'all maybe close tonight to opening it up, and y'all have opened it up to other bidding. And y'all, I hope, will make the right decision and for the citizens and the people that work in the county.
Thank you very much. Well, we have no one else signed in. Is there any more discussion? If none, I entertain a motion.
Chairman, I will say something before we open up for, last year when we started this process and we started looking at, and we voted to look at renewals every year, look at brokers every year. And I took three things into account: the service to our employees from the broker, the cost to the employees, and the fiscal responsibility to the taxpayers. All of those involve communication with the commission. There is no doubt, and I'm saying this directly to our brokers, there is no doubt that the employees have got impeccable personal service from you guys. The phone calls, the visits in the hospitals, that is the down-to-earth, boots-on-the-ground service that you guys have provided. One of the reasons I voted the way I did last year was that, to me, offset the amount of discount we'd gotten on the per employee per month for that level of service that we were getting to the employees. But we also have to look at, and I heard it 3 times tonight, communication and process. And I don't know that we are looking at the fiscal responsibility to our taxpayers if we don't know what our plan is bringing to us as we move along, so that we can foresee some of the issues and so that we can try to get a grasp on them. I'm not happy. I'm very happy with the level of service to our employees. But brokering, to me, is different than that. It's also a level of service of our plan to the commission and to the county itself. And I can't say that I'm happy with the level of our plan. We've had this, and it's a tough decision. We've had 17 years. We know the ins and outs. Our brokers should know the ins and outs of this county. And in my opinion, should know what we need as commissioners, because we're not insurance professionals, should know what we need to make the best choices. From all my discussions recently with other counties and other plans, it seems like they have better than we have, and we just didn't know it, and that's a problem. So I think that with the fact that we're going to look at brokers every year and we're going to look at renewals every year, I think it's time that we move forward and look at different brokers this year.
Is that a motion?
That's a motion.
Second.
State it a little clearer for the record if I'm
Are we going to pick a broker, or are we just looking at a broker?
Well, based on everyone holding the same prices as last year, Shaw Hankins was the lowest per employee per month broker. So I'll make a recommendation that we move to Shaw Hankins for the next year, and then look at brokers every year.
Second.
We have any more discussion? If none, all in favor, aye?
Aye.
Opposed? Ayes have it. Thank you. Shaw Hankins, we'll get with you after the meeting. I think you'll need something signed from us, so you can go ahead, and because time's of the essence.
Yes, sir.
Thank you. Moving on, we have a fire truck 12 and firefighters. Mr. Resner, you and Mr. Graham.
Mr. Chairman, after the last meeting, following up on that, we did send a letter to the city of Gray asking for clarification about stationing a county fire truck and a paid firefighter at the city's fire station. On the desk before you, you've got a copy of the letter that we sent to the city. Earlier today, we received a response back from the city stating that they do want us to continue stationing a fire truck and a paid firefighter at their fire station. So what we've attempted to do is memorialize that concept in an intergovernmental agreement. And you have that before you. Frank and I worked on the language of this some earlier today, I'll just kind of go through and hit the high points here. Basically, it states that we'll have one fire personnel assigned to the City of Gray Fire Station Monday through Friday from 8 a.m. to 5 p.m. and that person will be under the supervision and management of the county fire chief / EMA director. The next provision talks about the fire chief being responsible for selection of that person, training, oversight, so forth. C there talks about where we would station the fire engine, and I assume that would be the City of Gray's fire station. The next paragraph says that we'll be responsible for maintenance of the vehicles and fuel and those things. We'll work with the city to keep the station clean and so forth. It states that our fire chief will be the primary point of contact on our side. Then over on the next page, we go through and it states that this is a 1-year agreement that will automatically renew on the first anniversary. Later in the document, there's a provision about I believe it's a 30-day out. Says that the city shall appoint a primary point of contact with their fire department to work with our fire officials. It clarifies that the city will retain ownership of the building and grounds and their equipment. The next paragraph there talks about the city agrees to provide us unrestricted access to our equipment and to the City of Gray Fire Station. And then the city will maintain insurance on the facility just like they do now. Let's see. And then kind of the bottom half of that page, it says that the fire chief and the person appointed by the City of Gray will work together to resolve any sorts of procedural problems or issues that arise. And then it talks about anything related to the agreement itself could be handled between the mayor of Gray and or his designee and the county administrator. Modification has to be done in writing. D is the 30-day termination provision. And then E is kind of a funding clause there that basically says if for whatever reason we can't fund that position due to budget issues, then that there's a way to, I guess, modify the agreement based on those grounds. So, and Frank may have some additional comments on it, but that's kind of the kind of an overview of it.
I think that sums it up, what Jason said. As he mentioned, we've looked at it, talked about it. This is what we came up with, and hope it meets with the board's approval, and then we'll see if the city agrees.
Well, we got a letter from the city stating their desire for us to be in their fire station as part of it. I think that up to now, it's been pretty much a handshake, agreement. A man's word is his bond, but this day and time, I think a signed agreement is necessary. Any discussion, questions? If none, I need a motion to.
Mr. Chairman, I'd make a motion that the board approve this agreement and have you sign it tonight and send it on to the city as soon as possible for their approval. And after it is signed, sealed, and delivered, we put our truck back in that fire station.
Absolutely.
Second.
More discussion? If none, all in favor, aye?
Aye.
Oh, ayes have it. Do we have anything else tonight? Any department heads like?
Yes.
Mr. Graham?
Just one thing, sir. Chairman, I want to give a special thanks to most of the personnel that's here tonight. A good many of our firefighters, county firefighters. We had a fire today shortly before lunch at Trish Ann's down in Haddock at the caution light. It was a hard to get to inside the wall fire. It was identified fairly quick, but it was hard to get to. With it being a fragile 125-year plus building, there was minimal damage as far as our firefighters getting at the fire. But they did a quick knock on it, and I just want to say thanks on my end that we've got the best in the world, and I'm telling you straight up about that.
Amen. Miss Trish Ann was, I've never seen her in that state because she's always humble. She wanted to know how in the world we got there so quick. But again, it works with the paid guy in place, or at least ready, not coming from home, but ready to go. Mr. Risner, I appreciate you writing, and Frank also putting this, and I'm not sure, just the agreement in writing finally. With that being said, it says a lot. Although a good handshake and a nod it goes a long ways, but we see how long it's gone. But I think in this day and time, we need it in writing, and it's legal. We appreciate always your backing. We've got several roads ahead of us in the budget, and I just I appreciate every day that I get to be here and serve our people. I appreciate it.
We appreciate you, and we appreciate all the firefighters for what you do. Like I said, you the a great asset to this county. Thank you very much. I know Miss Trish Ann's, that's her heart. And for y'all to get in there and to take care of it so quick, that's great. Mr. Risner, looks like you're good.
I'm good.
Shannon, she's already left. Didn't want to leave her out.
She's back there.
You want to say anything? I don't dare leave you out. Last time you said I forgot you. Going farther. Mr. Pitt.
Any comments?
Comments from the public?
No, I'm just saying.
No, we've already done the 3 minutes.
Okay.
We're at commissioner's comments right now. Mr. Pitts, would you like to start tonight?
Yes, sir, Mr. Chairman. I don't have any comments. I think it was a very good meeting. I do have a comment. It was a good meeting. A lot of good information was shared. I'm looking forward to work with Shaw Hankins and doing what's in the best interest of our employees. I'm trying to save the county some money as well as the taxpayers. So, thank you, Mr. Chairman.
Thank you, Mr. Kitchen.
Thought all night about how to say it, and I don't know how to say it other than we have the best first responders in the world.
Absolutely.
That's all I can say. I love y'all. You're the best there are. Simple as that. Thank you.
Mr. Robinson.
I agree with Sam, and I want to thank our broker for the last 17 years for the service. As Sam said, it's been impeccable service. But with everything coming to light as it has, it's time to move on. And I'm glad that the board has made that decision. So, thank you.
Thank you. Commissioner Martin.
Thanks to our first responders. It's a difficult job, and it's a volunteer job that you guys do, and ladies, day in and day out. We couldn't do it, and I think in one of the most recent calls, I don't know that I could have even functioned. So we thank you. To our new brokers, we have a road ahead. I'm excited. It's been a fight that I've been fighting since I got here. My faith is restored, Mr. Chairman, because I vote for you. I don't get to vote for anybody else, but I vote for you. All right. I used to shake my head, but I'm feeling better. All right. So thank you, because it's not about me. It's about our employees and getting the best plan we can for them, and about our constituents, saving the money and our taxpayers. So thanks, and appreciate you guys. Looking forward to some good work.
I heard a deep breath. You through?
I'm good.
Sometimes you get another breath and go on. All right, we'll move on. Citizen comments. Anybody like to come forward tonight? Nobody like to come forward? Commissioner Pitts?
Well, that's it. Mr. Chairman, make a motion to adjourn.
Second. All fair aye?
Aye.
Thank everybody for coming.
Well done, gentlemen.
Thank you.
Thank you.
All right.
Bob,
It was good. It was good.